Hi everybody, Dr. Ahles here. In this short video, we're going to talk about the kinds of fluids that you have in your body, and we're going to talk about the way that the water and the solutes inside of them can move. When we talk about the human body, it's important to recognize that up to 60% of the body is made out of water. So in females, the range is a little bit lower, closer to 55%, closer to 60% in males. And as a person ages, the amount of water in their body actually declines. So recognize that this number is a little bit fluid, literally. But when we talk about the human body, a lot of water is there. There are two kinds of fluids that make up the water in the human body. So the first type, about 67% of all the fluid that you have, 2/3, is intracellular fluid. Intracellular means inside your cells. So the other name for intracellular fluid is cytosol. 2/3 of the water in your body inside your cells, the majority of it. We also have a lot of different kinds of extracellular fluids. Extracellular means it is outside of a cell. So a lot of that fluid is going to be found inside your blood vessels in the form of plasma, or it's going to be found inside your body tissues in what's called interstitial fluid. As we start talking about fluid movement here in a moment, recognize that even though these different types of fluids exist, they are all connected to each other and they will be exchanging things with each other. For each of the kind of fluids in the human body, we have what I like to call a recipe. So this is the things that if I wanted to make plasma, or I wanted to make interstitial fluid or intracellular fluid, I would need to add a lot of these things. So let's start with plasma. If I was making plasma, I would be making a fluid that has a lot of sodium, a lot of chloride, and a lot of proteins. And even though I already put that in bold for you, I want you to underline, highlight, star the word proteins, because it's those proteins in plasma that make them very different than interstitial fluid. Interstitial fluid, the fluid found between your cells inside tissues, has a high level of sodium and chloride, but not this high level of proteins. Plasma proteins, by the way, are things like clotting factors or antibodies, things that help your blood to do its job. Remember, though, that these two fluids only make up about 1/3 of the fluids in your body. The majority of the fluids in your body are intracellular, they're inside your cells. And when we talk about what's inside our cells, the key players are really potassium, more of those proteins, and this hydrogen phosphate, which we'll talk about soon as a buffering system inside your cell. But I really want to hone in on the fact that intracellular fluid has a lot of potassium, whereas my extracellular fluids have a lot of sodium and chloride. If you remember from A&P1, we said that your cells were like a salty banana. Bananas on the inside have a lot of potassium, and if it was a salty banana, on the outside, we'd have a lot of sodium and chloride. So as you're studying these body fluids, make sure we're aware of the recipe for each of them. I mentioned before that all of these types of fluids in the body are connected to each other and they're constantly exchanging things. You may see these different kinds of fluids discussed as compartments. So we have intracellular fluid inside our cells, that's one compartment, or the plasma is another compartment, just a fancy way to describe where we find the fluids. So when we're talking about the way that water and solutes move, there are different kinds of solutes that are doing this moving. Some of them are electrolytes. Electrolytes are things that have a charge, they're ions. So when we were talking about sodium and chloride and potassium, those are the kind of solutes that count as an electrolyte. We also see things like glucose or lipids or urea, a waste product. These float around inside these fluids as well. The way that the things are going to move, whether it's water or it's these solutes, it's going to be determined by something called osmolality. Now, osmolality is a little bit different than osmolarity, but they're essentially the same thing. When I'm talking about osmolality, Technically, I'm looking at the mass of things. So we're talking about a kilogram or a number as opposed to a volume. But when you're studying osmolality, it is basically the same thing as osmolarity. So when we look inside the body, your solvent, this kilogram of solvent thing, always going to be water. And the number of solute molecules is either going to be your electrolyte or your non-electrolyte. As I mentioned, all of your compartments are connected. Plasma and interstitial fluid and cytosol are all connected. So if I change the osmolality in one of these compartments, if your plasma suddenly has a higher or lower osmolality, that's going to affect all of my other fluid compartments because they are all connected. So when I'm thinking about what happens when these things are connected, I'm really talking about the process of osmosis, which is the special way that just water moves. So if I have an extracellular solution, whether it's plasma or interstitial fluid, that has a high osmolality, that means that I have a really high concentration of salt or really high concentration of sugar. Based on what you know about osmolarity, this means we have a hypertonic solution that pulls water out of my cells. They try to dilute it. The opposite is true as well, though. If the osmolality of a solution is low, that means there's a lot of water on the outside, and that's going to push water into our cells. But remember, if I push water from the interstitial fluid into the intracellular fluid, that's also going to cause water to go from the plasma into the interstitial fluid. All of these fluids are connected to one another. When we talk about water and the ions that are dissolved inside of it, water and ions are able to move both into and out of each of our body compartments. So they can go back and forth. We can very easily do exchange of these solutes. But when we're talking about other things, so for example, nutrients or waste products and gases, often those things can only travel one direction. So consider as you're thinking about the way that dissolved things move. Things like nutrients or dissolved oxygen, they're always going to move first into interstitial fluid, so from the plasma into the fluid around the tissues, and then they'll move from the interstitial fluid into our cells. This is how we do the process of getting nutrients into our cells. This is how we get the oxygen that we need into our cells. There's never a time where my cells are going to give away their oxygen or nutrients to the interstitial fluid. It just doesn't work that way. And the same is true when we talk about things like carbon dioxide or waste products. Waste products and carbon dioxide are always going to go out of our cells into that interstitial fluid, and then they're going to go out of the interstitial fluid into the plasma. Plasma will help me to get rid of them, essentially to get them out of the body. So when we're thinking about movement between these different compartments, maintaining homeostasis, remember that water and really small ions, these can go both directions. I'm going to modulate these things to keep the body at homeostasis. Everything else, my gases, my nutrients, my wastes, they're always only ever going one direction. And that's the direction that the body needs them to be moving.